Why does it seem like your doctor is always in a rush? It's because we are. Healthcare is changing and not for the better. Long gone are the days of the country doctor who used to take their doctor bag and go from house to house to sit down with you and your entire family to discuss all of your concerns in a leisurely environment. It's very rare to meet a doctor who's even been practicing within the same office for 5, 10, 15, or 20 years, so it's almost impossible to establish a long-term relationship with a primary care doctor. Now, healthcare feels so transactional. You've got a frazzled doctor who comes into the room 20, 30, or even 40 minutes late. They get set up with their laptop or their computer. They're barely making eye contact with you. And before you know it, that visit that you waited so many months for is over. You may be left feeling unseen, neglected, or unheard, and you're wondering why things are like this. It didn't used to be like this when you were a kid. We will discuss the limitations of primary care physicians functioning within this healthcare system. This is all to your benefit as a patient. If you understand what's going on behind the curtain, you can make a plan for how to take advantage of it. To put things into perspective from a primary care doctor perspective, clinic every day feels like a time management video game that you just can't win. The average primary care doctor is no longer their own boss. Most primary care doctors are employed by private practice clinics or mega hospital systems. We are no longer the top of the food chain within the healthcare system. We are really just middlemen close to the bottom of the totem pole. Being employed has its perks. However, it does come with a hefty price to pay. We are just regular employees like everyone else within the system. We have zero control over our schedule. We have almost no control over which patients we see and when. We definitely don't have any control over how much time we spend with patients either. Due to decreased federal funding, decreased reimbursement, and inflated administrative costs, most hospitals are underwater and are trying to make up for their financial difficulties with primary care labor. This means that primary care doctors are pushed to see as many patients as physically possible within their normal workday. As family medicine that works 10 to 12-hour shifts, I usually see between 40 and 50 patients per day. I've even heard of some of my OB colleagues seeing 60 patients within an 8-hour shift. That is just insane. Most employee doctors only have 15 minutes allotted per patient. Some of us are very fortunate to have an understanding healthcare system where you get 20 minutes for an established patient and 40 minutes for a brand new patient. However, that's not the case for most of us. Now, this 15 minutes does not necessarily mean 15 minutes in the room with you. 15 minutes includes pre-charting, attempting to scan through all of your previous notes, your lab work, your health history, your medications, to come into the room with a general understanding of what you've been through and who you are. Then we walk into the room, we introduce ourselves, we do our history, figure out why you're there. We have to do a physical exam. We have to think about what it is that we want to do for you moving forward. We have to discuss our plan, put our orders in, and write a 1.5-page paper about everything that we've spoken about so that you can get your visit covered by insurance. Those medical notes are not really for us. If we would have just said, okay, saw the patient, they're doing fine, this is our plan, that would be enough for us. But we have to document every single thing that's happened in the room, and we have to document it specifically in order for insurance to cover your visit. Now, some clinics, in a desperate attempt to raise revenue, are forcing overbookings of that 15-minute slot. So that means if two patients show up allotted for the same 15-minute slot, it becomes like a boss level video game that it's impossible to win. Without a double booking, it really means that we get about 7 to 8 minutes in the room with you, which is not fair to you and it's not fair to us. If there's any delays whatsoever, we fall behind. And chances are we actually give a crap about what we're talking to you about. We want to hear about your family. We want to hear about the things that you've been through. So we inevitably fall behind. And this is why you end up waiting 20, 30, 40 minutes for your doctor's appointment. Because if we just take an extra 2 or 3 minutes with each patient that we're seeing to try and establish a better relationship, that means each 15-minute slot is getting pushed back by 3 to 4 minutes. This is why your doctor is always frazzled, always late, always running behind, barely makes eye contact with you, always typing on the stupid computer, and always just trying to hold it together. Now, you may be thinking, that's what you went to school for. That's what you signed up for. But that is 100% wrong. Most of us went into primary care because we were at the top of our classes, we were really bright, and we really, really wanted to help people. We wanted to be in our communities, we wanted to serve, and we wanted to do good. I don't think any of us signed up to be punching bags for insurance companies or for disgruntled patients or hospital administrators. This is why most doctors do not stay in the same clinical practice for more than 2 to 5 years before moving on and trying to find greener pastures. Unfortunately for us, those greener pastures are few and far between, which is why most doctors are planning to leave clinical medicine within the next 5 years. Now, this is not excusing behavior. This is not justifying negative healthcare experiences. This is just trying to humanize what we go through as doctors and healthcare professionals, because a lot of nurse practitioners and PAs are under the same pressure. It is impossible to do a great job and to change lives and to give all of the guidance that patients deserve within 7 to 8 minutes of patient facing time. It's just not possible. Now, you may be thinking, okay, well, if you're seeing patients every 15 minutes and you're seeing 50 patients a day, why can't you see me sooner? Why can't you squeeze me in when I'm sick? The answer for that is that most doctors, if you see that they are accepting new patients on their hospital website, it means they're carrying a patient panel of anywhere between 1,500 to 2,000 patients. When I left my previous job, I had close to 2,000 patients that I was responsible for. If those 2,000 patients all want to be seen once per year, and I'm only able to see 50 patients per day or less, the math just doesn't math. It's impossible to get in. And unfortunately, since we aren't in charge of making our own schedules, I can't just put aside a spot for you. If I'm already overbooked, I can't just squeeze you in once you've left the hospital. Even though I'm following along with your chart and I get notifications about how you're doing and how things are going, I physically cannot do much more for you. However, many doctors that do plan to stay in medicine are fighting back. A lot of us are leaving hospital practices and starting our own clinics. I myself, with one of my best friends, have started my own practice where I can actually go to your house, sit down, and talk with you. I can actually hear about you. I can hear about your family. I can hear about what you have going on and really establish meaningful change. There's also something called direct primary care practices, which I'll talk about in an upcoming video, where you can actually have a subscription-based service where, just like Netflix, you pay a certain amount per month and you get access to that doctor for one-on-one quality time. The reason why I shared all of this information is not to complain, but more so to let you know what you're dealing with. If you know that you are only going to have 7 to 8 minutes with your doctor, you have to come to that doctor's visit prepared. You have to do your homework before you show up. What medications are you taking? What do you need refilled? What lab work do you need done for your job? What kind of paperwork does your job need to fill out? Do you need FMLA, short-term disability? You have to come with all of those things prepared. I, like many other people, get white coat hypertension, which means when you get to the doctor's office, you get nervous and sometimes you forget what you want to say. So instead of wasting your moment, make sure you write everything down that you would like to tell your doctor before you enter the room. I love when a patient comes to me with a list. Try to keep the list of the things that you want to discuss within your visit to just 3 things. Anything more than 3 things is going to overwhelm both of us. But if we can limit your visit to 3 things that you'd like to discuss, we can generally handle those things, get your physical exam done, get your lab orders done, get your medications ordered, and we might even have 1 or 2 minutes to spare so that you can tell me about how your sourdough starter is going, or you can tell me about how your grandkids' track meets are going. I'm going to do another video explaining a bit more how to take advantage of these 15-minute doctor appointments and even how to utilize the online messaging tools such as MyChart to your advantage. I hope this video sheds a little bit of light as to why your primary care doctor sucks so bad and why healthcare, from my perspective, is falling apart. Now you'll understand why you never see the same doctor when you go to the clinic, and it also seems why doctors leave as soon as they come. This system is not doing justice to patients, and this system is not doing justice to doctors who want to be there for you, want to engage with you, and want to make a difference in their communities. Unfortunately, the medical system right now is what it is. I'm hoping that we can create mutual understanding so that we can all function together within this horrible system that has been forced upon us. With a little organization and consideration on both sides, we can improve healthcare outcomes and satisfaction until the insurance companies change the rules on us again. Thank you for tuning in. This was The Breakdown with Dr. Mooney.